this video, we will demonstrate the index transverse adjustment. The index transverse technique is another option that can be used to correct for a contralateral relationship of rotation and lateral flexion. For example, a segment that is right rotated and left laterally flexed. We have previously defined the index transverse technique as an assisted technique. Therefore, what joint is affected when you contact the segment? The joint above or the joint below the malpositioned segment? Assisted techniques such as the index pillar affect the joint below. Since this is an assisted technique, we can contact the involved segment and will influence the correct joint, T1, T2 in this case. When using the index transverse technique for this subluxation, stand opposite the side of contact on the left side of the patient facing headward. Lean over the patient and contact the posterior aspect of the T1 transverse process with the distal aspect of the metacarpophalangeal bump. Drag tissue select posterior to anterior onto the transverse process. Your elbow should be bent with the forearm at a 45-degree angle. Indifferent hand number 3 is used with the left thumb contacting below the left mastoid process with fingers to the face. Bring the head up out of the headrest and once again look at the head position. What do you see in terms of pre-stress at this point? Remember, we're working on a right rotated and left laterally flexed segment. Is this pre-stress helping or hindering the lateral flexion component of the adjustment? Can you see that we have taken the head out of left lateral flexion and into right lateral flexion, setting up the correct pre-stress? What has this head position done for the rotation component of a subluxation? Can you see that we have taken the head out of right rotation and into left rotation, also helping our adjustment? The next video clip will show the entire sequence of events, ending with a thrust in a line of drive, posterior to anterior and lateral to medial.